So where this bone is located mainly? Your lower chin. Okay, so this is the mandible bone, and always remember the mandible bone is movable bone. Okay, so mandible bone join with your temporal bone, and from temporomandibular joint, by which this bone is movable. Okay, this bone is not fixed. So what is the main function of this bone? Open your mouth, and muscles of mastication also attach here. Okay, so this bone is very much important. So let us discuss regarding the parts. Okay, see properly. So the mandible bone having two parts mainly. Okay, one is body, another is ramus. Okay, so there are two ramus are present. One is right side, another is left side. Okay, and body is, this is the body mainly. Okay, see properly, the body is what shape? This is U shape or horseshoe shape. Okay, so the anatomical position is very simple. Okay, you can hold like this only. So this is your body. Always remember, body is horizontally present. Okay, but ramus is vertically present. Okay, so this is the anatomical position mainly. Okay, so this is the body. So in the body you can see there are two borders mainly. One is upper border. Here your lower teeth is impacted. Okay, this is the upper border, also called the alveolar arch. Okay, so this is the mainly your upper border, and this is the lower border or inferior border. So inferior border also called the base of the mandible. Okay, so this is the upper border, this is the lower border. Okay, and there are two surfaces are present. One is outer surface or external surface, another is inner surface or internal surface. Okay, in the external surface you can see here one line is present. Okay, here you can see one line is present, midline, one ridge like structure is present. Okay, this is called symphysis menti. Okay, and below this line here you can see one triangular like projection is present. This is called mental protuberance. Okay, because mental means the chin. Okay, so this is called your mental protuberance, and side of this mental protuberance here you can see there are two tubercle like structure is present. This is called your mental tubercle. So this is the symphysis menti. This is the triangular shape mental protuberance, and surrounding there are two tubercle is present. This is called mental tubercle, and here you can see posterior to your tubercle there are two foramen is present. This is called mental foramen. Okay, and this is mainly the external surface. In the inner surface here you can see one line is present. See, one line is present. This is called the mylohyoid line. Okay, mylohyoid line. Okay, or mylohyoid line. So here your mylohyoid muscle is attached here mainly. Okay, and upper part of this, here you can see this line is divided this part into two way. Upper part, this is called your sublingual fossa, and below part it is called submandibular fossa. Okay, in the sublingual fossa your sublingual salivary gland is present, and here your submandibular fossa, submandibular salivary gland is present. Okay, and here you can see one ridge or tubercle like structure is present. This is called your genial tubercle. Okay, there are four in number: superior, inferior, superior 2, inferior 2. See here, there one is ridge like structure is present here. Okay, ridge like structure. So below this part here in the chin part mainly means the base of the mandible, there are two fossa is present here. Okay, this is called digastric fossa. Okay, here mainly your anterior belly of the digastric muscle attach here. Okay, anterior belly of the digastric muscle attach here. Two fossa is present here. This is called digastric fossa. This is mainly present your base of the mandible. Okay, so that's all about the body of the mandible. So there are two surface, external, inner surface. External surface are present mainly the symphysis menti, mental protuberance, mental tubercle, mental foramen. Okay, and here see there are two fossa here. Two fossa is present. Okay, below your incisor teeth. Okay, this is called incisive fossa. Okay, incisor canal, premolar, molar. So this is called your incisive fossa. Okay, here two in number, both the side of your this symphysis menti. Okay, here two depression like structure or fossa is present, this is called your incisive fossa, okay. And this is your mental foramen, okay. And inner part, there are one line is present, this is called mylohyoid line. Upper part of this line, this is called your sublingual fossa. Here sublingual salivary gland is present, and below of this line, this is sublingual fossa. Here sublingual salivary gland is present, okay. And here you can see one ridge like tubercle structure is present, this is called genial tubercle. There are 4 in number, superior to inferior to, okay. In the base, there are 2 fossa is present, this is called your digastric fossa. Here anterior belly of the digastric muscle attached here, okay, anterior belly of the digastric muscle. Now the ramus, okay. See, this is quadrilateral in shape. There are 4 borders are present. One is anterior border, another is posterior border, another is inferior, another is superior border, okay. See here properly, in the anterior border, upper part of the anterior border is free, okay, but lower part are continuation to your body of the mandible, okay. So upper part is free, but lower part is continuation to your body of the mandible, okay. Here you can see one line is present, okay, continue to your anterior border. This is called your oblique line, okay. This is called your oblique line. Here your buccinator muscle is attached in this oblique line, okay. Now there are 2 surfaces are present. One is external surface, another is inner surface. Always remember, in case of your ramus of the mandible, the external surface is called the lateral surface, okay, and the internal surface is called medial surface. So external surface, medial surface, okay, means external means lateral surface and medial surface, okay. And here there are 4 borders present. See, this is the posterior border, this is the inferior border. So posterior border and inferior border together form one angle. This is called your angle of the mandible, okay. This is called your angle of the mandible, okay. And this is your superior border. Here you can see there are 2 processes present. This is called coronoid process, another is condylar process, okay. Coronoid and condylar process. See properly here, in the condylar process there are head and neck is present, okay. So this is the head and this is the neck. This is your condylar process, okay. And here you can see one small fossa like structure is present, okay, small depression. This is called your pterygoid phobia, okay. This is the pterygoid phobia here. So, and this is one notch is present, this is called mandibular notch. So in the superior border there are 3 main structure is present. This is your coronoid process, this is the condylar process, and this is your mandibular fossa, okay. And this condylar process having 2 parts, one is head, another is neck. In the neck, one depression like structure is present, this is called phobia, okay, pterygoid phobia. Now in the external surface, always remember there are muscles of mastication, masseter muscle is attached here, okay, in the external surface, also called the lateral surface, except this part, okay, because here your which gland is located? Here parotid gland is located here. So except this, here mainly your muscles of the mastication, masseter muscles is attached here, okay. Now the inner surface or medial surface. In the inner surface, here you can see 2 foramen is present, okay. This is called your mandibular foramen, okay. Upper part of this foramen, one ridge like structure or tubercle like structure is present. This is called lingula, okay. This is called lingula. And below, here you can see one groove is present. This is called mylohyoid groove, not mylohyoid line. So this is the line, mylohyoid line. Here mylohyoid muscles is attached, and this is the mylohyoid groove, okay. So that's all about the ramus. So body and ramus. Now the muscle attachment. Always remember, in the chin means lower chin, the base of the mandible, here which muscles is attached here? Mainly platysma muscles is attached here, okay. And in the oblique line, masseter muscles is attached, okay. And the side means the ramus of the mandible, here mainly masseter muscles, the muscles of the mastication are attached here, okay. Now in the digastric fossa, anterior belly of the digastric muscles are attached here, okay. Now see the slides, okay, one by one. If you want, you can write it down or you can take photo, okay. So mandible bone is mainly present your lower jaw, okay, and this is the largest, strongest bone of the lower face and bears your mainly the lower teeth, okay, lower jaw teeth, okay. So this part is called your alveolar arch. Okay, here your lower jaw teeth is impacted here. Okay, next the parts you all know, the body is horseshoe shape or U shape. Okay, and the ramus is vertically present. So the body is horizontally present and the ramus is vertically present. Okay, now see, so this is mainly the body. Okay, and this is the ramus. Okay, this is the coronoid process, this is the condylar process, and this is your mandibular arch, and this is the ramus, and this is the body mainly. Okay, now this is the alveolar process where your lower teeth is impacted here. Okay, and this is the alveolar process. Now see, there are two surface, external surface and inner surface, and two border, superior border and inferior border. Inferior border also called the base of the mandible. Okay, now these are the parts, okay, which is present mainly the external surface. Symphysis menti. Okay, median ridge on the external surface of the body. So this part is called your symphysis menti. And mental foramen, this is the mental foramen. Okay, mainly present your premolar teeth. Okay, yes, premolar teeth, below your premolar teeth, this is the premolar teeth. Okay, incisor, canine, premolar, molar. Okay, so below this your mental foramen is present. Okay, or posterior to the tubercle of the mental. Okay, mental tubercle ke piche. Okay, so next is oblique line. So this is the oblique line. This is the mainly the continuation of your, which part? This is anterior border of the ramus of the mandible. Okay, and incisive fossa is present here below your incisor teeth. Okay, here you can see this is your superior border, this is the inferior border, and here the tooth is impacted, and this is the mainly the mental foramen below your premolar teeth. Okay, and this is the symphysis menti, and this is the mental protuberance, this, and here the mental tubercle is present, and this is this incisive fossa. Okay, and this is the oblique line, continuation to your anterior border of the ramus of the mandible. Next, this part. Okay, this part mainly, here you can see the mylohyoid. This is the groove. Okay, this is the groove is present posterior to this line. Okay, mylohyoid line, this mylohyoid groove is present here. Okay, so this is the mylohyoid line and this is the mylohyoid groove. Okay, this is the genial tubercle. Okay, this is the genial tubercle. Okay, in the midline, in the inner surface, this is the genial tubercle, 4 in number, superior to, inferior to. And here you can see in the base there are two fossa is present. This is called digastric fossa. Okay, next is the ramus of the mandible. This is mainly vertically present and 2 in number, right and left side. Okay, now in the ramus of the mandible there are two surface. Outer surface is also called the lateral surface and medial surface, and 4 border, anterior border, posterior border, inferior and superior border. And there are two process, coronoid process, condylar process. Okay, see here, this is the coronoid process and this is the condylar process. Condylar process having head and constricted neck. Okay, and this is the mainly the ramus of the mandible. This is the angle of the mandible. How the angle of the mandible is formed? By your which two border? Posterior and inferior. Posterior and inferior border together they form your angle of the mandible, and this is the mental foramen. This is the base of the mandible. Okay, and this is the oblique line and this is the body, and this process is called alveolar process where your teeth is impacted here. Okay, next this is the inner view. Here you can see this is the which foramen? Mandibular foramen. Okay, mandibular nerve and vessel passes through this foramen. Okay, so this is the mandibular foramen and this is the lingula. This is the lingula. See here, one depression like structure is present, tubercle like structure, and here the mylohyoid groove is present. Okay, and this is the mainly the angle, and here you can see this is the digastric fossa. Here anterior valley of the digastric muscle this is attached, and this part is called which fossa? sublingual fossa. Okay, upper part of your this line, mylohyoid line, this is the sublingual fossa, and below this is the submandibular fossa. Okay, here sublingual salivary gland is present, here submandibular salivary gland is present. Next, the angle of the mandible. How the angle of the mandible is formed? By your posterior border and inferior border. Now the muscle attachment. You have to know the main muscles attachment here. Okay, first is this muscle. This muscle is called muscles of mastication, mainly the masseter muscle. Okay, and in the oblique line here the buccinator muscles is attached here. Okay, and in close to your mental foramen, the mentalis muscles is attached here. Okay, and base of your mandible, this platysma muscle is attached, and here you can see this process is called coronoid process. Okay, here your temporalis muscles is attached. Okay, here. So these are the main muscles. Okay, here you can see this is the, here your parotid gland is located. Okay, upper part of this part. Okay, this process is called condylar process. Close to this condylar process, your parotid gland is located. Next, in the inner surface, here you can see there are two muscles are present. This is called lateral pterygoid, because here you can see one fossa is present in the neck of the ramus of the mandible. Okay, this is called your pterygoid fossa. Here your lateral pterygoid muscles is attached, and in the angle of the mandible, here the medial pterygoid muscles is attached here. Okay, so always remember the masseter muscle, lateral, medial pterygoid is together called the muscles of the mastication. Okay, and here this is the mylohyoid group, mylohyoid line. Here your mylohyoid muscles is attached here. Okay, and here the anterior belly of the digastric muscles is attached here. So these are the muscle attachment, and temporalis muscle is mainly attached here, this process, coronoid process. Okay, now this is the muscle attachment, you all know, and here you can see the genioglossals and geniohyoid. Okay, arise from your superior genial tubercle. So this is your genial tubercle. From the superior genial tubercle, your genioglossals muscles is attached, and inferiorly the geniohyoid muscles is attached here. Okay, this is your genial tubercle, 4 in number, superior to inferior to, and platysma mainly present the base of the mandible here. Okay, next the masseter muscles is attached the lateral surface of the ramus of the mandible, and temporalis is present mainly the coronoid process here, and the lateral pterygoid are attached mainly the neck of the ramus of the mandible, and the medial pterygoid muscles attach mainly the angle of the mandible. Okay, next the ligaments. Here you can see the ligaments is attached between your temporal and mandibular bone. Okay, so there are 4 ligaments are present: stylomandibular ligament, temporomandibular ligament, sphenomandibular, and pterygomandibular ligaments. So there are 4 ligaments are present. Now, if you tell all those things regarding this bone, then examiner may ask these things. Okay, male and female mandible. Okay, so the size of the male mandible is quite larger as compared to the female, and this is the body of the mandible. The height is quite larger in case of the male, but in case of the female it is quite lesser. Okay, in the size, and the condyles means this, the condylar process is in case of the male it is larger, but in case of female it is smaller. Okay, next by looking this is called which foramen? Mental foramen. Okay, by looking the mental foramen you can tell, so this is the children mandible bone, you feel infant or adult or old age. Okay, always remember in case of the children the mental foramen is always lower side, because here your teeth is not properly developed, that's why your mental foramen is lower. Okay, but in case of the adult this is present in between the upper and lower border. Okay, so this is mainly adult bone. Okay, in case of the old age, this is present mainly the upper part. Okay, so see, at the infants and children, the body of the mandible is mainly made of the alveolar part, okay, containing both the deciduous and permanent teeth. That's why in case of the children, this is lower, okay, but in case of the adult, this is present mainly the midline, okay. See, middle between your upper and lower border, okay, but in case of the old age, this is present mainly upper side. So it lies close to the alveolar border. This is mainly the alveolar part, okay, alveolar border, due to the resorption of the alveolar process. That's why in case of the old age, this is upper, okay. And there are another difference is present by looking the angle of the mandible, okay. This is the angle of the mandible. So in case of the children and old age, this is 140 degree, okay, but in case of the adult, this is 110 degree. And by looking this process, this two process, see here, this is called your which process? Coronoid process. In case of the children and old age, here you can see the coronoid process is upper as compared to your condylar process, okay. But in case of the adult, you can see the condylar process is higher, okay. See here the relationship between the condylar and coronoid process. So condylar process projects above the level of the coronoid process, means the condylar process is higher, okay, in case of the adult, but in case of the children and old age, this is lower as compared to your coronoid process. Next is the fractures of the mandible, okay. The fractures of the mandible mainly occur the three region, okay. These are the three commonly region, okay. This is called your which part? The neck of the ramus of the mandible, okay. And this is the which part? Mainly the angle of the mandible, okay. And this is the canine region, okay. Here your canine teeth is impacted here, okay. So at the neck of the mandible, this is the first weakest point. So how this part get fractured? By any kind of injury like fall from height or any kind of trauma, okay. So another is the angle of the mandible, okay. This is the angle of the mandible, because here this is the curved structure, so these things get easily fractured, okay. And another is the canine region of the body, okay. So these three parts get easily fractured. So that's all about the mandible, okay.